Hello, so today we're going to talk about permanent anterior teeth. Just keep in mind that dental anatomy is a super dry and boring subject in itself, so I'll do my best to keep it interesting, but just hang in there. I'm just going to go over what I think are high yield topics. I'm not going to go over every single detail, obviously, so I'm going to try to keep my slides for each teeth to be about 2 slides or less. Alright, so just some generalities. So the dental formula for anterior teeth is going to be incisors 2/2 and canines 1/1. And if you don't know what the dental formula is, all it is the formula for your teeth for half of your mouth. So the numerator would be your maxilla and your mandible, or the denominator is your mandible. So all it's saying is you have 2 incisors, 1 canine, and 2 premolars and 3 molars. So calcification dates for all anteriors are, they start calcifying before age 1, and that's relevant because the fluorosis of your teeth occurs typically when your teeth are still calcifying. So some people who like take fluoride pills or something, or somehow get way too much fluoride in the body, they get dental fluorosis. So that usually happens up until age 8, which is when your permanent second molars are done calcifying. But just know that anterior teeth starts calcifying before age 1, usually around like 3 to 6 months, depending on which tooth. And then eruption sequence. So this is just something you need to memorize. The way I remember it is I start from, so mandibular teeth usually erupt before maxillary teeth. So the mandibular teeth centrals are the first ones, and then your laterals are going to come. So mandibular centrals come at age 6 to 7, then your mandibular laterals 7 to 8, your maxillary central is going to be 7 to 8, and then your maxillary laterals are going to be 8 to 9, and then you're going to go to your canines. Mandibular canines are 9 to 10, and then your maxillary canines are 11 to 12, and the reason because is you actually have premolars just inside here, and that's going to be 10 to 12. So you can kind of see it's easy to remember because if it's 6 to 7 for the mandibular central, the next one is just the last number of the next one. So 6, 7, 7, 8, and then 8, 9, 9, 10, 10, 12, 11, 12. And last thing is root completion is complete for permanent teeth 2.5 years after they erupt. And that's true for all permanent teeth. For primary teeth, it's about 1.5 years after they erupt for the tooth to be completely formed. So facial lingual view, all teeth have a crown shaped like a trapezoid with a short side gingival. What that means is if you just think of this as a trapezoid, the shorter side is going to be where your CEJ is, or close to the gingiva, and that is for all teeth. From the proximal view, which is what we have right here, the anterior teeth have a crown shaped like a triangle or a wedge. And so that's going to be all anterior teeth, which is all the teeth that we covered today. And mesial incisal angle is more square, the distal incisal is more rounded. So what that means is, if you look at this is the mesial and this is the distal. The distal incisal angle right here is more rounded, as opposed to right here, it's more square or more sharp. And the easiest way to remember this is D has a curve here, it's rounded, and M, these are like sharp points here, so that's going to be more like sharp, I guess, or square. And so that is a rule that's going to apply pretty much for all anterior teeth. Some teeth are going to be more similar in shape, but just in general, the distal is still going to be more rounded, even if it's just slightly more rounded. So contact points. Remember we talked about this earlier. This is a table just for incisal gingival contact points. I think the easiest way for me to remember this is for mandibular, all the contact points are incisal except for the mandibular canine. That's going to be the mid 1/3. And then for the maxillary, I just remember that the distal is always a little bit more gingival than the mesial. So if you start with a central, which is going to be in the incisal third, as you go more distally, it's going to go one level behind. So if it's incisal here, it's going to be the junction of the incisal and middle, and this is going to be the incisal a junction of the incisal and middle for the mesial of the lateral, and if you go one back, the distal is going to be in the middle, and then so that's how I remember it. Good luck. And then all teeth have a facial lingual contact point in the middle third of the crown. We went over that too. It's just rule for all teeth, so you don't have to worry about that. So embrasures. Facial embrasures are narrower than lingual embrasures on all teeth, and the only exception to that is the maxillary first molar, where the facial embrasure is wider than the lingual, and then between the mandibular centrals, which is what we're going to talk about today, where the facial is actually equal to the lingual embrasure. And what this means is the lingual surface of the teeth are usually thinner than the facial embrasure, because if you think about it, if you have like a if we were just looking at, let's say this is the, we're looking at this occlusally, if the facial sides of teeth are bigger than the lingual sides, then the embrasures are going to be wider on the lingual side than on the facial side. That's kind of, maybe that's not the best picture, but you get the point. And then incisal embrasures for anterior teeth, from biggest to smallest. The biggest one is going to be start from here, the maxillary between the canine and the lateral. Then you're going to go down mandibular, canine to lateral. Then you're going to go back up, lateral and central, and then between the two centrals. Then you're going to go back down, lateral and central, and then the smallest one is going to be the two centrals. That's just how I remember it. I just go up, down, and then you stay up, and then you go back down. And then you go from right to left. Or maybe not right to left, but you go distally to mesially. Okay, so now we're talking about incisors, so not canines, just incisors. So remember, the incisors are the centrals and the laterals for both maxilla and the mandibular. So most teeth develop from 4 developmental lobes. The only exception to that are the maxillary and mandibular first molar and the mandibular second premolar. But other than that, every other tooth in the mouth comes from 4 lobes. And so mamelons are bumps found in the incisal edge of permanent incisors. There's these guys right here. And so you're going to have 3 mamelons, and those represent 3 of the 4 developmental lobes. So you're going to have a mesial, you're going to have a distal, and then you're going to have a middle lobe right here. And so you typically only find mamelons on younger people or newly erupted incisors, because as you get older, just normal attrition from eating is going to wear away the mamelons. So a clinical correlation would be, if you see mamelons on someone who's older, that would probably mean they have an anterior open bite or some other malocclusion, which is keeping the teeth from occluding properly. So the cingulum is going to be your 4th developmental lobe. So the mamelon represents 3, and the cingulum is your 4th one. And so what the cingulum is just this little bulge right here back, and when you look at your tooth lingually, and it's just where the mesial marginal ridge and the distal marginal ridge are going to join. And so the cingulum is centered in 3 teeth, the maxillary lateral, the maxillary canine, and the mandibular central. So that's where the cingulum is going to be in the middle. And then for 3 of the teeth, the maxillary central, mandibular lateral, and the mandibular canines, those are going to be offset distally. So we'll see that when we look at the teeth individually. And these roots, all these teeth have 1 root, and they typically only have 1 canal. So let's start with the maxillary central incisor. So what the unique facts about maxillary incisors that you should know, maxillary central that you should know for boards, is the widest anterior tooth mesial distally. You can kind of see that if you just look at someone's mouth, like the 2 big teeth that you're going to see that are really wide are going to be the centrals. But remember, that's anterior teeth. You can't compare anterior to posterior, because posterior teeth are generally bigger. So the mandibular first molar is the widest overall tooth. It's the only tooth with a pulp wider mesial distally than facial lingually. So all that's saying is if you look at this tooth is wider mesiodistally than it is facial-lingually, so the pulp is going to be wider in that way too. And for all other teeth, usually the buccal or facial-lingual is going to be just as thick, if not thicker, than the mesiodistal. The only tooth with cross-sectional CEJ that appears triangular, so that's because you have a very flat facial surface. So if you kind of look at this, you have a triangular shape. So it's the only tooth with the cross-sectional through the CEJ that will be a triangle. Everything else will be like an oval or a diamond or a rhomboid or something. And it is the second tallest crown in the mouth. So this is actually a slightly controversial thing because there's so many variations between teeth. We learned in Dr. Trutenon's class, she's going to say that this is actually the tallest crown in the mouth. But according to Wheeler's Dental Anatomy, which is considered the Bible of dental anatomy, that one says that the mandibular canine has a slightly taller crown than the maxillary central. So, and I'm pretty sure the boards go by what Wheeler says. So I would say if you want to study for boards, the mandibular canine is going to be the tallest crown, the maxillary central is going to be the second tallest crown, and the maxillary canine is going to be the third tallest. So remember, it's a trapezoid, but this is, so it has like a nice fan shape. It has a short but very straight root, and it has a blunted apex. Remember, the cingulum is displaced distally, so you can kind of see that right here. This is the mesial, and this is distal. So this is the incisal view. We're just taking this tooth and rotating it about 90 degrees this way. So this is the mesial, this is distal, and you can see if you drew the line here, the cingulum is offset distally. And so what that means is your mesial marginal ridge, which is this part right here, is going to be slightly longer than the distal marginal ridge, because the mesial marginal ridge just pretty much goes from as close as you can to the incisal surface over to the cingulum. And so if you have a cingulum is displaced distally, you're going to have a shorter distal marginal ridge, and you're going to have a longer mesial marginal ridge. And then you have the cingulum right here, and then right here is going to be the lingual fossa. So all it is kind of like just a groove that's in your tooth, and you can kind of see that right over here. And incisally, it has that nice triangle shape, just like how when you have a cross-section of CEJ, you get a triangle shape. So moving on, the maxillary lateral incisors, it's very similar to the maxillary centrals, which is why they come after each other. In terms of some facts, you should know that they're the best developed lingual anatomy out of all the teeth. They're most likely to have dens and dentae, or dens vaginatus, and whatever they're also called. They're the second most congenitally malformed or missing tooth. The most common is the third molars, and then comes the maxillary laterals, and then after that is the mandibular second premolars. And if they're malformed, they're usually going to be peg-shaped. So the maxillary laterals are pretty similar to the maxillary centrals. The main differences are the root. So even though the root is as long, if not longer, than the maxillary central, what you will find is that it has a distal inclination. So if you have a tooth that is inclined, the root is inclined in a direction, is always going to be distally inclined, except for the mandibular canines. Those are the only teeth that can have a mesial inclination. All other teeth will be inclined distally, including the maxillary laterals, whereas you don't see that in the maxillary centrals usually. The crowns are much smaller than the maxillary centrals. Well, not much smaller, but the crowns are smaller than the maxillary centrals. But another thing you notice about them is that the distal incisal angle is much more rounded compared to the mesial incisal angle, and that's because as you go from mesial to distal, the incisal edge actually slopes cervically, so it goes towards the cervix. So what that means is you're actually going to have a smaller distal marginal ridge than you would the mesial marginal ridge. You're still going to have the height of contours in the cervical thirds here, just like you do all anterior teeth. So you can see here that the facial edge is much more rounded than the the facial edge on the maxillary centrals, and so what that is going to give you is a more of an oval shape because your facial lingual dimensions now is much thicker than they were here in the maxillary centrals. So you're going to have a nice oval incisal view, and also your cingulum is going to be in the center. In the maxillary centrals, the cingulum was distally displaced. And lastly, you have on the distal side of the tooth, sorry, that's really badly written. On the distal side of the root, you're going to have a groove running from the lingual pit area all the way down the side of the root. And a clinical correlation for that could be that because you have that distal groove, it makes it more difficult to do scalar root planing. So moving on, hope I'm not going too fast. Mandibular central incisors, so things to know about that. It's the smallest tooth in your mouth. It's the narrowest tooth mesiodistally, and it's also the most symmetric tooth. So because it's really symmetric, it's actually really difficult to tell the difference between whether you're looking at the mesial surface or the distal surface, like if you're the left mandibular central or the right mandibular central. Because it's so symmetric, that is the reason why that the facial embrasure is the same size as a lingual embrasure. So one of the old board questions says, it's the only mandibular anterior with both its mesial and distal incisal gingival contact point at the same level. So even though earlier we said that both the mandibular central and the mandibular lateral both had the distal and mesial incisal gingival contacts in the incisal third, the mandibular lateral is going to have the points in two different parts of the incisal third. So if this is the incisal third, then the contact point might be up here and then down here for the other one. But for the mandibular centrals, it's going to be pretty much like in the same exact level within the incisal third. So that's like a nitpicky question, but you can, even if you don't know this fact, you should know that just because it's the most symmetric tooth, that's why it's probably going to have, that's going to be the correct answer. So it is the first succedaneous tooth, but it is not the first tooth that erupts. So you have 6-year molars, which are your first molars that erupt, but those do not replace any teeth, so they're not considered succedaneous teeth. So 6-year molars. The reason for that is because your premolars actually replace your primary molars, so your 6-year molars aren't replacing anything, so they're not succedaneous teeth. And then it's going to have the smallest facial embrasure out of all the teeth in your mouth, and it has the smallest incisal embrasure too, if you remember. So as you can see, it's super symmetrical. Pretty much the mesial incisal angle right here, and the mesial incisal angle and the distal incisal angle are pretty much going to be 90, but the distal is still going to be slightly more rounded, just a smudge. So the lingual edge, the incisal edge is lingual to the long axis of the tooth. I actually have that here twice. What that means is the long axis is right here. The long axis is right over here. So if you just draw, really bad line. If you draw, the incisal edge is lingual to the long axis of the tooth. For the maxillary centrals, they're pretty much centered. So lingual anatomy is going to be the same: mesial marginal ridge, distal marginal ridge, lingual fossa, and cingulum. So your lingual fossa, your cingulum, and then you're going to have your mesial marginal ridge, and then distal marginal ridge. And you can see that if you look at the incisal view, this here is going to be facial, and this is lingual. We're just pretty much taking this and flipping it 90 degrees over, right? So this is still going to be distal, and this is going to be mesial. Your cingulum is pretty much in the center, and then your mesial marginal ridge and your distal marginal ridge are going to be pretty much the same length. And you can see incisally, this has much more of an oval shape than the triangle shape that we saw with the maxillary central. And 40% of them have 2 root canals. So if you have 2 root canals within one root, the root canals will be positioned facial lingually. So pretty much, if you have two root canals, it can either be like this, where it's mesiodistally, or it could be like this, where it's facial-lingually, right? And so if a tooth has two root canals within one root, it's going to be facial-lingually. And then if you notice right over here, there's some grooves within the root. So both the distal and the mesial are going to have grooves in the root. The distal groove is much more pronounced, and it's going to be touching the mesial groove in the lateral inside, the mandibular lateral incisor. And something that we didn't say, did we talk about heights of contour? No. So heights of contour, as we said in the other video, heights of contour is for anterior teeth is going to be in the cervical third for both posterior, or for both lingual and facial. So you can see that here, the height of contour here is going to be in the cervical third. Here it's going to be in the cervical third. If you look at all the other teeth, the heights of contour is going to be in the cervical third for all anterior teeth. So moving on, so the mandibular lateral incisors. So what's most unique about the mandibular lateral incisors is going to be the fact that the incisal edge is twisted on its apex. So what that means is, if you're looking at this here in the incisal view, this is going to be facial, this is lingual, this is mesial, and this is distal. As you go, so just to orient yourself, we're taking this tooth and we're rotating it like towards us. So towards us, 90 degrees. Remember the root points distally, or the incline distally, so this is going to be distal, this is going to be mesial. So as you move this towards us, you're going to have, this is going to be mesial and this is distal. If you remember, you're going to have the cingulum is going to be displaced distally for the mandibular laterals. So that's another way you can tell if this is distal. So what I mean by the incisal edge is twisted on its apex is when you go mesial to distally, you're gonna the incisal edge is gonna curve towards the lingual surface. So this is curving lingually, and what that does is now you can see more of the facial side as you go mesial to distal. So mesial to distal, incisal edge twists or curves lingually. So now you're gonna expose more of the facial surface when you're looking at it on the incisal edge. That's why this part here is much bigger than this part right over here. It also has a sloped incisal ridge, so as you go mesial to distal, it's going to slope gingivally down. It's kind of hard to see in this tooth, but pretty much what it means is it's going to go slope this way as you go from mesial to distal. And so that's what makes the lateral incisor unique, and it's actually pretty obvious if you look at other pictures or you look at your typodont, like you'll see that it's curved, and it makes it much more you can distinguish that from the mandibular centrals. So it's clearly a lot less symmetric than the mandibular centrals. You remember that you're going to have much more rounded distal incisal angle than you would with the mesial incisal angle. So that is going to be much more sharp or square than the distal incisal, which is much more rounded. In terms of the lingual anatomy, out of all the anterior teeth, it's going to have the least defined lingual anatomy, and that's because you have a much shallower lingual fossa. You have less curvature here, and what that means is it's much harder to figure out like where exactly the mesial marginal ridge is starting and where the distal marginal ridge is. And the incisal edge is lingual to the axis. You can't really tell as much in the mesial view, which is what this is. But you remember, as you go from mesial to distal, it's curving lingually. So if you look at it in the distal view, it's pretty obvious that it's going to be more lingual. So not as apparent in the mesial view, but as you go distally, it's going to curve more lingually, and you will see that the incisal edge is lingual to the axis. So canines. So the difference between canines and incisors. So first of all, they don't have mamelons. So you'll see that the developmental lobes are slightly different. They're going to have long crowns and long roots. And the lingual anatomy is slightly altered, so instead of having that one lingual fossa, now your lingual fossa is going to be split by a lingual ridge. And what that's going to do is the lingual ridge is going to split the lingual fossa into a mesial fossa and then a distal fossa. And then canines are much wider buccolingually than incisors. You can tell as you went from the maxillary central, which is the super thin facial-lingually, I guess, facial-lingually, and as you went more distally, they just get kind of like wider and wider facial-lingually. So the canine is going to be much wider facial-lingually than incisors. So maxillary canines are the widest anterior tooth facial-lingually. So if you remember when we started off with the maxillary centrals, it kind of had like that triangular shape because it had a very flat facial surface. And then we went to the lateral incisor, it had the more oval shape because the facial surface was much more rounded. So the maxillary canine is going to follow that same pattern. It's going to be much wider facial-lingually than the incisors, and what that means is the root canals itself are going to be much wider as well. Because if you remember, so the root canals itself follow pretty much the same shape as the overall tooth, which is why the maxillary central is the only one with root canals that are wider mesiodistally than they were facial-lingually, because it's super skinny facial-lingually. So if you kind of imagine, the canal would be really small, right? So the canal for the lateral incisor would be bigger than the maxillary central facial-lingually, and because the canine is the widest facial-lingually than the other incisors, it's going to have a much wider canal if we're looking at this incisally right now. So if this was the canal, it'd be much wider. So what else? It's the longest tooth incisal apically. It has the longest root, but it has the third longest crown. So remember, the mandibular canine is just a smudge taller than the maxillary central in terms of crown height, and the maxillary canine is going to come in number 3. But overall, it's the longest tooth, and it has the longest root. And by having the longest root, it also means that it's the most stable tooth in the mouth. And because the mandibular canines have the second longest root, and the mandibular canines are the second most stable teeth in the mouth. And the last thing about, I forgot to say about incisors versus canines, is that incisors have an incisal edge, whereas maxillary canines are going to have a cusp tip, or a cusp. So incisors have incisal edge, and canines are going to have one facial cusp, and that's why they get the name like vampire fangs or like wolf fangs, is because they have one sharp cusp. So as we said earlier, you're going to have, instead of having a lingual fossa, you're going to have a lingual ridge. So this lingual ridge is this part right here. So this lingual ridge is going to bisect your lingual fossa, and instead you're going to have two fossa. One over here is going to be your mesial fossa, your distal fossa, and then you're going to have your mesial fossa on the other side. So the maxillary canine has actually the most well-developed cingulum also, so that's another fact that I didn't put on. But in terms of all the anterior teeth, the maxillary canine has the most well-developed cingulum. So if you get on the board question, that's what you're going to answer. It's going to have pretty much a center-aligned cingulum. So your mesomarginal ridge and your distal marginal ridge are going to be about the same length. And so the incisal edge is facial to the axis, so same thing. If you just draw the long axis, it's slightly more facial. And lastly, the mesial cusp slope is shorter than the distal. So what that means is, if you look at it right here, this is the distal part of the tooth. The distal cusp slope is right here, and this is the mesial cusp slope. So this is the mesial cusp slope. Mesial cusp. And then this is your distal cusp. You can see that the distal cusp travels much farther than the mesial cusp. So the rule is, anytime you have a tooth that has one facial cusp, the mesial cusp slope is always going to be shorter than the distal cusp slope. And the only exception to that is going to be the primary maxillary canines, and also the permanent maxillary first molars. premolar, sorry. Let me rehash that. Anytime you have a tooth with one facial cusp, the mesial cusp slope is always going to be shorter than the distal cusp slope, except in primary maxillary canines and maxillary first premolars. So that pretty much covers the canines. Oh, actually, last thing. So remember we were talking about the developmental lobes. So for the incisors, you have the mamelons, which represent the 3 developmental lobes, and the cingulum was the 4th. So instead, you're going to have your developmental lobes right here on the facial surface of the tooth. So right here, you can see this would be the distal developmental lobe. This would be the mesial developmental lobe, and right here would be the middle developmental lobe. So instead of having the mamelons, the developmental lobes come and actually form the facial aspect of the tooth. And then same thing, you're going to have your cingulum be your lingual lobe, or the 4th developmental lobe. So mandibular canines, in terms of anatomy, they're pretty similar to maxillary canines. Some quick facts about them: they have the longest crown, so remember it's just a smudge taller than the maxillary central. At least that's what Wheeler said, and that's what I assume the board is going to go by. And then the maxillary canines come at number 3. The maxillary canines have the longest tooth overall, so the mandibular canines are number 2. And for the longest root, it's the maxillary canine, so for the mandibular canine, it has the 2nd longest root. And then the mandibular canine is the anterior tooth most likely to have a bifurcated root, and it's actually quite common that the canine does have a bifurcated root, so this is more of a developmental variant than an anomaly. And so earlier we said it's the only tooth that has a mesial inclination of the root. So what that means is if you get a question and it has a tooth with a mesial inclination, it is most likely going to be the mandibular canine. But that does not mean that every single mandibular canine has a mesial inclination of the root. It can also have a distal inclination. All it's saying is that all other teeth will be distal inclination. Any tooth that does have a mesial inclination would be the mandibular canines, but it could be either one. So the anatomy is pretty similar to the maxillary canine. The differences are the cusp is actually duller than the maxillary canine. But other than that, if you look at the lingual anatomy, you're going to have a cingulum. It's not going to be as developed as the maxillary canine because it has the most well-developed. This one is it's probably better developed than the incisors, but it's less developed than the maxillary. The cingulum has a slight distal inclination, as you can see right here. So that means your mesial marginal ridge is going to be slightly longer than the distal marginal ridge. And actually, if you look at this tooth right here, this is an example of a distal root inclination on a mandibular canine. And so earlier, like the easiest way to tell if a tooth is distally or which side is distal is just see which way the root's pointing. So you can't do that for the maxillary canine because it could also have a mesial inclination. So you have to go by the rule that we said earlier that if you have a facial cusp and it has a mesial cusp slope and a distal cusp slope, the mesial cusp slope is going to be shorter. So if we look at right here, this is the mesial cusp slope, and the distal cusp slope is much longer, or not much longer, but it's longer. So you know this side is distal and this is mesial. Other than that, it's going to same thing. You're going to have a lingual ridge that's going to be splitting your lingual fossa into your distal fossa and your mesial fossa, and then the incisal edge is going to either be centered or lingual over the axis, just depending on what kind of variant you have. So this one would be kind of crooked line, but it's going to be slightly lingual to the axis. And one last thing between the mandibular canines and the maxillary canines is the maxillary canines, sometimes or often you'll find a lingual pit just incisal to the cingulum, and that's something that mandibular canines typically do not have. So if you do see a canine with a lingual pit, then think maxillary canine. So that pretty much covers anterior teeth. Again, this is mostly just big picture and most important high yield stuff. There's a lot of small details like what is the proportion of the root to the crown that I didn't go over, but I honestly don't think it's worth studying if you don't have the time. But hope you enjoyed this, and good luck studying.